Hi, my name is Cody Fleck, and I'll be doing the head-to-toe assessment for foundations today. Hannah Opp, can you please come into my clinic?
Yes.
So right there, I would be testing Hannah's walking, making sure she's walking normally, she has balance, she can walk with her hands, moving her hands, swaying. She has an easy time getting up without using her hands, and her balance is good. So next I'll be introducing myself. So I'll be your nurse today. I'm Cody Fleck. Can I get two patient identifiers? Name and date of birth, please.
Hannah Opp 7599.
Perfect. Next, I'll do patient privacy. So I'll put a curtain up, do hand hygiene, and I'll check the patient's provider orders onto the computer. So making sure that what we're doing today is a head-to-toe assessment, physical examination. Next, I'll be asking why. Next, I'll be telling you or explaining the procedures to you. So we'll be doing a head-to-toe assessment. I'll be touching you, feeling your temperature, making palpating and percussing. So if you feel any uncomfortable at any time during this procedure, just raise one of your hands and we can stop and take a break. Next, can you tell me a little bit about yourself, why you came in here today?
I came in because I was putting on lotion the other day, about 3 days ago, and I noticed a bump on the back of my right thigh. And I was concerned because it hurt when I would wear tight clothing and stuff like that. So I'm not sure what it is.
Sounds good. We will take a look at that then. Next, do you have any past history that we should know about? Any surgeries?
Yes, I have a benign brain tumor. So I had a brain biopsy when I was about 6, so 2006, and I had a breast reduction in 2018, no, 18, yeah. And I also have severe migraines because of my brain tumor.
Sounds good. Next, I'll be asking about your family history. So do you have any alcohol abuse, depression, anxiety that runs in your family, any cancers?
Yeah, so my mom, lung cancer runs on her side of the family. Okay. And then on my dad's side of the family, addiction and depression and anxiety run on both my parents' sides.
Sounds good. Next, I'll be asking, are you on any medications, over the counter or prescribed?
I take Lexapro every day for my anxiety, and that's 20 milligrams. And then I take melatonin as needed, 5 milligrams for sleeping. And then I take ibuprofen as needed for just my migraines or whatever else.
Sounds good. And then, so do you have any screenings that you go about that protect yourself, such as seatbelt, sunscreen, doctor's appointments, physicals? So you wear a seatbelt, you have to wear sunscreen.
Yep.
And then, so do you have eye examinations yearly, annually, and then dental examinations annually?
Yes, I go to the eye doctor every 6 months, and I also go to the dentist every 4 to 6 months.
Perfect. And then next, can I ask you some questions about the bump on the back of your leg? So when was the onset of that? When did you notice it?
About 3 days ago.
Sounds good. And then what is do you notice any redness, pain, itching, swollen?
Yeah, it kind of itches and it is a little painful when I'm wearing clothes, like I said, and when I'm not wearing anything, then it feels a lot better. Yeah.
And then where's the location? You said the back of your leg then? The upper right? Sounds good. And then so characteristics, you already talked about that, the pain, redness, and then alleviating, you also talked about that. Is there anything that you do that really helps alleviate the pain? Like icing, lotions, any creams?
No, I mean, not really.
Sounds good. And is the pain radiant? So is the pain through your body, or is it just one spot?
It's just around that.
Okay, perfect. And then, so again, the time was 3 days ago. Perfect. So next will be checking, just starting your physical examination. So first we checked for cranial nerve 8, which that would be your balance, your walking. Next will be your hearing, so that also has to do with cranial nerve 8. So I'll just whisper a word to you and let me know if you can hear it and say back to me.
Dog.
Perfect. So your cranial nerve 8 is intact. Next, we'll do the Romberg test. So if you can stand up for me. Perfect. And then we'll just stand at your sides, close your eyes, and we don't want to be weighing or swaying, and make sure your balance is good. Perfect. You look great. Next, I'll be examining your head. So I'll do hand hygiene. Put some gloves on. So do you have any itching, lice,
I-
dandruff, dry patches, or anything that I should know about with your hair?
I don't have lice, but I do have dry scalp, so I have dandruff
Sounds good.
sometimes.
So I'm just gonna take a look, looking for any dry patches, any lice, any dandruff, just making sure everything's good and normal. Looks good. Perfect. Okay, so then I'll take my gloves off. I'll do hand hygiene and get some new gloves on. And then I'll be looking at your ears. So then we will do the whisper test, which you already did. Next, I'll be checking your face. So then we'll do the cranial nerve 5. So that, can you just open and close your eyes for me? And your mouth, your jaw, perfect. And then next will be also testing cranial nerve 5. So I'll be having a sharp and a soft object. If you can close your eyes, I'll rub one on your face. Can you tell me if it's a sharp or the dull?
Dull.
And then we'll do one more.
Sharp.
Perfect. So your cranial nerve 5 looks like it's intact. Next will be, I'll be palpating your temporal and mastoid muscles and your mandibular joint of your jaw. Can you open and close for me too? Thank you. And then do you have any TMJ or issues with your jaw?
I do
Okay.
have slight clicking when I
Yep,
open and
I
close.
can feel the slight clicking. Next, I'm gonna assess your swallowing. So if you can just take a drink of water, I'll assess your swallowing. Feel it, making sure it's normal. Perfect. Next, I'll be looking at your eyes. We'll be using the snail chart. If you can read it, we'll shut one eye, then we can open another eye, hand over your mouth, just making sure you can read your chart and testing your eye vision.
Put my glasses on or off.
You can take your glasses off, please. Never put them on. Good.
Can't really see much.
Then again, put them on.
Okay. Okay. B, D, F, G, C.
Perfect.
And then B, D, F, G, C.
Perfect. Looks like you have 20/40 vision. Next that was cranial nerve 2, so your cranial nerve 2 is intact. Next we'll be checking your cranial nerve 3, so we'll be assessing your eyes. Can you open and close your eyes again for me? Good. And then I'll be looking at your eyes, making sure the color and the symmetry. Next can you take your glasses off for me for a second? I'll be testing your dilation, and this will be cranial nerve 3. Good. Dilation's intact and good. Dilation is good in that eye too. Thank you. Next, I'll be checking cranial nerve through 4 and 6. So this, I'll just have you follow my pen light and we'll be moving your eyes. So this is just the movement of your eyes. So we'll go in an H formation. Perfect. And then if you can just follow all the way to your nose. Perfect. Next, I'll be looking at your mouth. Can you open your mouth for me, please? Do you have any issues with your mouth? Any cavities or any sores or toothaches that I need to know about? Perfect. Next, we'll just be seeing if you can feel your tongue. So if you can open your mouth and say ah. So raise your hand whatever side I'm poking on. Perfect. Perfect. So do you go to the dentist? Do you brush your teeth? Do you floss?
Yes, I go to the
Perfect.
dentist all the time.
Good. Then you floss and brush twice a day at least.
Yes.
Perfect. Then I'll be assessing your speaking. So this will be cranial nerve 7 or 10. So I'll have you say a word and see if I can hear it. You can just say ha ha.
Ha ha.
Perfect. Now I'll be assessing cranial nerve 7. Can you smile? Puff out your cheeks. Open and close your eyes. Then I'll open and close your eyes with restraint. Close them. There you go. Perfect. Passing all of those tests. Next, I'll be looking at your nose. First, we'll be testing your patency. So if you can breathe out the other nostril. Breathe out the other nostril. Perfect. And we'll be smelling the cinnamon or smelling a scent, and you just tell me what scent it is.
Cinnamon. Cinnamon.
Perfect. Next, we'll be assessing your neck and shoulders. So can you just move your neck back, forth, up, down, side to side? Are you in any pain or discomfort during this? Perfect. And then can you shrug your shoulders for me? Perfect. And then shrug your shoulder restriction. Perfect. Next, I'll be looking at your ears. They should be gray And then they should be, cone of light should be at 5 o'clock and 8 o'clock. There should be no drainage, no redness, no inflammation or anything like that. Looks good. Eardrum is gray. Cone of lights are perfectly intact. No redness, drainage. Both the ears look intact and symmetrical. Next will be assessing the lymph nodes. So do hand hygiene, put new gloves on. Then I'll be feeling your lymph nodes up and down your neck, back of your neck, all over, down your spine or your chest, under your armpits. Perfect. All of them feel good. Any pain or discomfort when I'm doing this?
Mm-mm.
Do you feel any pain or discomfort with any of your lymph nodes at this time?
No.
Perfect. Next, we'll be doing a range of motion. So first, I'll be doing range of motion of your jaw. Can you open and close your jaw? Move side to side. Perfect. Next, we'll be doing the our shoulder. So can you abduct and adduct your shoulders for me, please? Thank you. And then put your hand on your stomach and on your back of your head. Perfect. Then we'll be doing both of those with restraints. Good. And the next one. Perfect. Then we'll be doing abduct and adduct of your, or flexion extension of your forearm. Back, forth. Good. Then we'll be doing the same thing with the wrist. Good. Can we do the fingers also? Abduct and adduct your fingers. Perfect. Then we'll do pronate and then supinate. Perfect. Then we'll do the Tingles test. So I'll be poking your wrist. Good. Then we'll be doing the Phantoms test. So can you pray? And backwards pray. Perfect. Any pain or discomfort with that?
No.
Perfect. Next we'll be doing my hands. So can you grab my hands? We'll be testing the strength of your hands. Good. Her strength is good and intact. Next we'll be testing the hips. So can you stand up for me, please? Adduct and abduct your hips, side to side. Perfect. And then can you flex and extend your legs? Perfect. And then can you do the same with the knee joint? Flex, extend, perfect. And then dorsiflex your foot and plantar flex your foot. Perfect. And then can you abduct and adduct your toes? Perfect. And then we'll be testing your spine. So if you can just turn around for me, can you bend over? We'll be seeing if you have any scoliosis, making sure your spine is intact. Spine is perfectly centered, in line, symmetrical with the rest of your body. Any pain or discomfort when I'm touching your spine?
No.
Perfect. And then can you bend backwards for me? Any pain or discomfort when you do that?
No.
Perfect. You can sit back down. Next, we'll be doing the last part of the neurological test. The first part was you walking, so checking your balance. Next, we'll be doing the finger motion, so we can just touch your hands to all your fingers. Perfect. We'll do the other hand. Next, we'll be doing the finger test. So can you bring your finger to your nose? Perfect. Next, we'll be doing the heel to your shin. Have any issues with that? Perfect. Next, we'll be checking your reflexes. So I'll be having your arm like this. This will be the tricep test. Perfect. This arm. Perfect. Then we'll be doing the bicep. Perfect. And then the brachioradialis. And we're doing the patellar or the quadricep. Perfect. And then we'll be doing the Achilles. Perfect. And then we'll be doing the plantar flex. So if you can plantar flex your foot. And I'll run my hammer along the base of it. Perfect. Next, we'll be assessing the skin. So I'll assess your skin, look at any moles, look at any bruises, any discolorations, feeling the temperature, feeling the textures of it, looking at your nails, checking the papillary refill, making sure it's less than 3 seconds, checking the papillary refill on your toes. Perfect. Then we'll be checking for DVT in your legs. Perfect. Then we'll be checking edema. Perfect. DVT and edema on this side. Perfect. Any pain or discomfort with any of your legs? Next, I'll be taking a look at your back of your leg, your mole. Perfect. Yeah. Solid red. Perfect. Thank you. I think you just have an infected ingrown hair, looks like. Next, I already did the capillary refill, and then I'll be doing the trigger test. So I'll just be pinching your skin. Perfect. And then whenever I touch the hands or the face, I will be changing my gloves and doing hand hygiene in between. Next, I'll be checking your pulses. So first we'll do the carotid test. So can you change your, turn your neck to the side? Perfect. I would check this for a minute, making sure it's in range. Next one. Checking for a minute, making sure it's in range. Then I'll be checking the jugular test. Can you turn your neck to the side? Making sure it's not extended, it looks good. Checking this side, making sure it's not extended, looks good. Next, I'll be listening to the radio or feeling the radial pulse. Checking for a minute on the radial pulses. Next, I'll be checking the brachial pulse. I'll also be checking for a minute on this side and this side, making sure it's in range. Next, I'll be checking behind the knee, the popliteal. Next, I'll be checking the posterior tibia on her foot, and then also the top of her foot. And these all should be in range. They should be at a range of 3 normally. Next, we'll do respirations. So I'll take my gloves off. Do hand hygiene. Next, I'll be checking the shape of the chest, making sure there's a 1-to-2 ratio on the thoracic cavity. And I'll also be making sure the angle of her chest is within 90 degrees. Next, I'll palpate her chest. Palpate the back of it, making sure everything feels normal. Next, I'll be doing the tactile fermentation test. I'll be putting my hand in the back of her back and feeling the vibrations when she says a word. Can you say a word for me, please?
Dog.
Perfect. So the vibrations are symmetrical and even. Next, I'll be palpating, percussing the lungs. Also do that on the back. All percussions sound good. They should be a hollow noise if I'm over the lungs, so there's no liquid in the lungs. And if I'm over a bone like the rib, then it should be a dull noise. And they both were dull and hollow when I was over the lungs and over the bones. Next, I'll listen to all the lobes of the lungs. First, I'll be starting at the apex. Take a few deep breaths for me. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. And a deep breath. Then I'll be doing the same on the back. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Next, I'll be seeing if I can hear when Hannah says a word. So say a word for me when I put on the back here.
Dog.
Perfect. It should be faint and I shouldn't be able to hear it, which was exactly how it sounded. Next, I'll be checking the cardiac assessment. So I'll be assessing the heart sound. I'll be assessing all 5 of the heart sound or the heart locations. So first I'll be checking the aortic, which is in the second intercostal space. Next, I'll be checking the pulmonic, which is also in the second intercostal space. Next, I'll be checking the Erb's point, which is in the third intercostal space. Next, I'll be checking the tricuspid, which is in the fourth intercostal space. Next, the mitral valve, which is in the fifth intercostal space. Perfect. And I'll also listen in the back, making sure everything sounds good and normal, in range. I would listen in both of my diaphragm and the bell of my stethoscope. So I'll go through and listen on the other side quick. Perfect. Everything is in range. I'll feel the apical pulse. Wait for a minute and count. Then I'll also listen for the apical pulse with my stethoscope. Wait for a minute and count. Those are all in range and look good. I should hear no murmurs or extra noises like S3 or S4. All I hear is S1 and S2, which is normal. Next, I'll be checking the abdomen. Can you lay back for me? So first, I'm going to listen for abdomen or bowel noises in all 4 quadrants. Perfect. Next, so the bowel noises are steady. They're not too fast, but they're not too slow. They're 30 noises a minute, which is normal. Next, I'm going to percuss all 4 quadrants. It should be dull when I'm over an organ, which is correct. And then I'll palpate lightly, feeling if everything feels normal. Then I'll palpate the bladder. Does that hurt at all? And any pain? Perfect. Then I'll assess the abdomen reflex. So I'll put my hand on if you can sit up for me. I'm going to put my hand on the back of her, where her kidneys should be. And if I hit and she's in any pain, then she could have an infection or a kidney stone. Next, I'm going to do the wave test. So if you want to lay back down for me. So I'm just going to see if there's any fluid in the lung or in the abdomen. Perfect. No fluid in the abdomen. Perfect. So that is the end of our assessment. Are you in any pain or discomfort with that?
No, not with that.
Perfect. So on a scale of 0 to 10, are you in any pain at all right now? With your pimple or?
Yes, my ingrown hair is like about a 4 right now.
4? Yeah. Perfect. Next, I'm just going to educate you on some things you can do to prevent ingrown hairs and infections. So first of all, we're going to have your provider prescribe you an antibiotic to help get away from the infection. Next, you can use lubricating gels to shave. Shave in the direction of the hair so it doesn't irritate you as much. You can use unscented shaving lotions. I would recommend unscented. Also use a lubricant for when you shave, and then also an aftershave to help release some of the tension. And then also, since you were kind of concerned about it being an STD or skin cancer, I would just like to educate you on safe sex, making sure you use condoms, going to get STI checkings every so often, and also wearing sunscreen as much as possible whenever you're in the sun. Next, I'll be educating you on your migraines, since you do have quite a few migraines. So some relieving factors for migraines would be exercising, relaxation techniques, massage, sit therapy, and then take it just therapy to talk to remove some stress, or acupuncture is known to help. I would also recommend having your provider prescribe you with any pain management medications. I would also recommend you to make sure to relieve as much stress as possible, because that is a big concern with migraines. Also, improving your sleep habits may help with migraines, and also having a normal, healthy diet. And that will be it for our examination. Thank you, Hannah.
Thank you.